Good afternoon and welcome to our weekly COVID-19 update for the town of Plymouth. This is number 82. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here each Wednesday at noon for this update. This forum is being brought to you live by PAC TV on Comcast Channel 15 and Verizon Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants joining Ken Tavares, Matt Muratore, and me include Dr. Philip Triffletti, Dr. Mark Wilson, Plymouth Police Chief Michael Botieri, Plymouth Assistant Superintendent Erik Cioffi, Michael Jackman. And at this time, we're going to begin with the chair of the Select Board for the town of Plymouth, Ken Tavares. Welcome, Ken.
Thank you, Steve, and good afternoon to everyone. I am so pleased to open this afternoon with some very good news. Early this morning, the town of Plymouth began the vaccination of our frontline first responders, and I understand that, and we can hear more from the police chief, that things have gone very well both in the police department and in the fire department. This has been a long time in coming, but we are so pleased for all of the work that's been done to get to that point today. So again, the front line is receiving the vaccine as we speak today. Also, the Board of Selectmen voted to meet on February 2nd to discuss the one-way traffic in the center of town and also the barriers. We had quite a bit of experience last year by trial and error, and we're going to again go out to the public and get comments to see if this is something that's feasible to do again this next season. That's it for the moment, Steve. Thank you.
Thank you. And that's Kenneth Tavares. He is chair of the Plymouth Select Board. We're now going to begin the medical portion of our presentation, and we're going to begin with Dr. Philip Triffletti. He is an attending primary care physician at Beth Israel Deaconess. Welcome, Phil.
Thank you very much, Steve. Glad to be here today. It's a new day for our country. We have a new president in the Oval Office, and I think it's a very exciting time, a time for optimism. Obviously, our democracy was challenged in the recent weeks, but we're surviving, and I think there's lots of good things that may happen with the new administration. I know that we'll be participating more with the World Health Organization. That President Biden's written an executive order to renew our relationship with the World Health Organization. And I had also heard Dr. Fauci was going to be named as a special, ambassador for that work with the World Health Organization. So I think there'll be a lot of things. Obviously, Biden's very firmly focused on the pandemic and the response to the pandemic. And I know, he plans to put the full weight of the government behind, things that we can do to try to, stop the pandemic. So very, very exciting time for the country. I thought I would start by talking about vaccines, because that's, I think our main way of getting out of this pandemic is really going to be through the vaccines. And I think, interestingly enough, to date, if you're following the numbers, about 36 million doses of vaccine have been produced and distributed to the states. And this is versus a promise. At this point, we were supposed to have about 50 million vaccines produced. So you can see we're running a little bit behind. But, I think there's still optimism that the manufacturers will be able to keep up and continue production at high rates, as Biden had set a goal for having 100 million doses given in his first 100 days. I think some people think that's not ambitious enough. They'd like to see, more like 2 million doses given a day as opposed to 1 million. But, when you think that thus far we've only averaged about 500,000 doses per day, to double that and keep that consistently going for the next 3 months, I think would be a major achievement and a major impact on what's happening. So, the timeline originally that was promised by the manufacturers, we hope to have approximately 300 million doses between Pfizer and Moderna by the end of March. And we have 2.5 months to meet those original promises for vaccine, and then another 100 million doses coming from Pfizer by the end of July. So that would be 400 million doses, or enough for 200 million people, and that's just with those two companies. So hopefully we can stick to this timeline pretty well. And I think one of the things that was supposed to happen today, if it hasn't happened already, President Biden was going to sign the Defense Production Act, to try to really commandeer more resources for production of the vaccine and distribution of the vaccine. So, I think he will be putting, more resources at his disposal from his position as president to really try to speed up this process. I do get a lot of questions constantly, really. People are certainly very worried about the pandemic and worried about their vulnerability. And so a lot of people want to know, when will I get the vaccine? And I carefully go back and forth to the mass.gov COVID-19 website. And, they've done a good job, I think, of describing what they plan to do. And, of course, they have the graphs where they show phase 1, phase 2, phase 3. And I think what's been quite remarkable, if you look at Massachusetts and then you look at what's happening nationally, I think our governor and the state of Massachusetts, his advisory group, I think they've very much stuck to their game plan in terms of, they said, we will give vaccines to the hospitals, we'll give them to long-term care facilities, we'll give them to assisted living facilities. Then we'll go to first responders, as Ken was mentioning, in Plymouth, they started that last week. And then I think they're also starting up now this next week, the home healthcare workers, which will be basically getting almost to the end of phase 1. And, phase 1, it looks like it's supposed to run, through from February 1st through part of February. And then if we're fortunate, we'll start to get to phase 2 when we start doing more of the general public, perhaps by the end of February if we're lucky. I get a lot of questions about what's a comorbidity. And, really, you can think of that as a high-risk medical condition. And, of course, there's a long list of them. And, some of the obvious ones are things like people who have had cancer, particularly if it's more advanced cancer or active cancer under treatment. Obviously, chronic kidney disease, COPD, emphysema, congestive heart failure, diabetes, severe obesity. These are all, common high-risk medical conditions. And I think basically, from what I've heard from the Advisory Council in Massachusetts, I think this will be, really looked at from the perspective of the honor system between doctors and patients, being truthful about, what their conditions are, when they are looking for their qualifications to receive the vaccine. But of course, age will be a big part of it. Age is really the predominant risk factor, probably more than anything. And so, in phase 2, you'll see people over the age of 75, and then possibly Massachusetts hasn't really said exactly what their plans are, but, probably also people who are eventually those over 65. So, the highest risk people by far really have been the long-term care facilities, where we know, we've had majority of the deaths. And, people who are in a long-term care facility, if they get infected, they have about a 30% risk of dying. So that's why, I think it's been so good that, we've been actively immunizing people in the long-term care facilities, because those are the highest risk. Now, obviously, other states don't do it the same. The federal government, they asked states to submit their plans to the CDC, but some states decided to do things differently, like Florida. Florida decided not to immunize healthcare workers first. They decided to go directly to the elderly in the communities. And so it's a different approach. I think, time will tell, what approach maybe perhaps is the best approach. But, I do, one of the things I again want to compliment, our government officials here in Massachusetts is that I think, it seems to be a little bit more of a chaotic situation in Florida. And, thus far in Massachusetts, we really haven't had, that type of, chaos out in the communities with, either people waiting in lines for excessive periods of time or signing up and not being able to get their shots, or, having not able to get through on telephone lines to book their appointments. So, a lot of logistical problems I think you're hearing come out of Florida. And so far, I think things here, going much more smoothly. So I tell my patients, there is no sign-up program that I'm aware of yet for any, patients at large in the community. But, it is coming, and it probably, in a matter of weeks, you'll start to see, some of the older age groups in the community getting immunized. But again, I think we're doing very well sticking to our game plan, and, hopefully that will continue. In terms of the companies making this, just an update there, we know we have Pfizer, we have Moderna. There's Johnson & Johnson, who has completed phase 3 trials, and we're waiting for them to submit their data to the FDA, and that should happen within a few weeks. In terms of the production capability of Johnson & Johnson, my understanding, from scouring the news media was that, they might not have a lot of vaccine available until April. So if they do get approved, we might get it, more vaccine coming from another company, another resource, but, it probably won't be as immediate as it was when Pfizer and Moderna were both approved. We immediately had some vaccine available. I think, we may have to wait a little bit before Johnson & Johnson supply will be available. It's probably worth a few minutes talking about the variant in UK, and there's been other variants obviously described in South Africa and elsewhere. And of course, experts explain, mutations are normal. One of the unfortunate things with this variant UK B117 from the UK is that, it is more contagious. And so it appears to be about 50% more contagious. And so when epidemiologists do calculations, that means that you could have the virus that, it might infect, 11 times more people because of its contagiousness compared to the predominant variant that we've had here in the United States. The predictions are that this variant may become our predominant variant approximately sometime in March. The more contagious virus will probably, take over and be more common in the community than the present strains. So I think that's one of the concerns probably when you look at different models for what's going to happen. I think a lot of our numbers actually look fairly stable here in the state of Massachusetts. Our hospitalization rates have stayed fairly stable around those 2,000 numbers. And, the number of new infections per day, to me, when you look at the curves, it looks like it's stabilizing somewhat. Percent positivity rate, down around 6%. So, I see a lot of encouraging things. And most importantly, of course, is our hospital capacity. Right now we have about 85% of beds are being utilized. So we still have some 15% available for beds, and the ICU is 79% utilized, meaning we have, still 21% availability in ICU. So in the state of Massachusetts, we're very fortunate still to have, good bed capacity, which I think is a great thing. If we can, continue to see these numbers go down in terms of infections, hopefully we'll be in a good place. But I think the biggest unknown in wildcard really is, what's going to happen with the variant going forward over the next few months. So I think that brings us back to some of the same old story, which is, what do we do for mitigation? What do we do for prevention? And, I think, masks is still our number one thing that we have to emphasize. Masks do reduce the spread. They're not 100% protective, but they're very good. And so I encourage people, obviously to wear masks. I think our mask wearing behavior here in the state of Massachusetts is we have good adherence. And, the biggest weakness really is, I think, when people have temptations to have family gatherings, holidays, birthday parties. I was talking to a member of my family somebody wants to go to a wake coming up this week. There's all kinds of reasons. It's hard to postpone or not participate in some of these activities, but I think trying to keep indoor activities to a minimum. I think indoor is really much more hazardous because the virus is likely airborne and likely floats around in the air for hours or days. So you want to avoid being unmasked indoors with other people for extended periods. I think that's our biggest hazard. So you want to try to do things outdoors. If you're going to be indoors, you want to be wearing masks at all times. I would say that's continues to be our main message, until we reach herd immunity down the road with all the vaccines that are coming. So I think a lot of great things happening, a new federal government in place. Hopefully they can, meet that goal of, 100 million doses in the next 100 days. I did get my first vaccine, and I'm going to get my second one in a couple weeks. And, I encourage anybody who's out there, if there's any hesitancy, talk to your doctor about the safety and effectiveness. But in my opinion, it's an extremely safe vaccine. There's no live ingredient, so you can't get infected from it. And it's very safe and very effective. So thanks, Steve. Happy to take questions later on. And it's a beautiful new day here in the United States.
Thank you. Dr. Philip Triffletti, he's the attending primary care physician at Beth Israel Deaconess. Again, we're here each week with you to provide these updates. We're doing it in an effort to provide you with verified information from experts, both in the medical field as well as town officials and other people at the state and the federal level. Joining us next week, we're going to be having Dr. Barry Potvin. He is the chair of the Board of Health, and he'll be joining us in the medical segment. Also, Sarah Cloud. She is Director of Behavioral Health at Beth Israel Deaconess. She'll also be joining us in the medical segment. Heather Cosby is a CPA in Plymouth. Stephen Cole is the Executive Director for the Plymouth Regional Economic Development Foundation. They will all be joining us next week, along with a representative from the Plymouth Public Schools. And at this time, we're going to continue. You can send your questions to plymouthinfo@pactv.org. And now Dr. Mark Wilson is joining us. Welcome, Mark.
Thanks very much, Steve. And today, what I thought I would do is try to provide some updates on research results that some of the listeners may not be familiar with. Dr. Triffletti had a nice segue for me because I wanted to say something about the new virus strains. And I thought I'd start with reminding everybody that we should really expect these strains to evolve and to change. Most of these genetic mutations are really not important and don't really have an influence on an organism's ability to survive or replicate. But for the SARS-CoV-2 virus, there have been many mutations actually, and quite a few now strains are recognized as new to our world. And there's some evidence, as Dr. Triffletti mentioned, that a few of these may actually be more easily transmitted. What I wanted to report on is studies that both Pfizer and Moderna have produced that suggest strongly that their vaccines are still effective against severe disease from these new strains. And so in order to seriously compromise the vaccine effectiveness, these new virus strains would really have to develop multiple significant mutations, and that's something that will take a long time. And it's really unlikely to happen immediately. And the fact that we're monitoring these new strains now regularly and testing them against the vaccine efficacy means that we'll really likely be on top of the new strains that, as I say, we should expect. There's been genetic sequence research of these newly isolated strains. It's underway now, and a $15 million appropriation from the CDC is available for doing this testing. So for now, the vaccination will be protective against these new strains. And so until it's your turn to get vaccinated, as Dr. Triffletti mentioned, wear your mask and keep your distance socially. Let me say a few words about concerns that some people have also expressed about the vaccine. I agree that the vaccine is not really a panacea, and widespread vaccination alone is not likely to end the pandemic. But these new vaccines are absolutely the most important public health opportunity that we have going for us now. Here are some facts. Everybody knows that the vaccine is not 100% effective, as was just mentioned. But remember, nothing in life is absolutely certain. And these COVID vaccines that we currently have available and are being distributed in the United States now are really very close to 100%, astoundingly so. The alternatives that we have been using, masks, social distancing, hand washing, and so forth, are even less effective, but they still have had an impact on reducing transmission. The Moderna and Pfizer vaccine studies have shown that they're about 95% effective against serious disease, which is really almost unheard of. Surprisingly, they're among the most effective vaccines ever created. Their impact is going to sharply reduce cases and allow hospitals to return to normal. But that effectiveness is actually, in a sense, underestimated because the remaining 5% that might experience mild disease will still have been immunized and therefore won't be a burden on the health system. And so essentially all simulation models that indicate widespread vaccination is going to really crush the pandemic given enough time and enough people vaccinated. Another fact, there is not yet rigorous evidence of whether vaccinated people can still spread the virus, but it would be really astounding if many people could. Most studies that I'm aware of have suggested there's that possibility, but it's very unlikely that many people will still be able to be infectious except shortly after being vaccinated before antibodies have developed. And this is true with all other examples of other vaccines that we know and have been widely used. And so, again, the argument here is that people should be willing and able to take the vaccine and not worry about becoming infectious after that. They should be protected against infection and not putting other people at risk as well. Something else, we know that the risk of side effects of these vaccines are not zero. But of course, again, nothing in the real world has zero risk. A tiny percentage of people may have allergic reactions to the shot. We also know that after getting the shot, your arm is going to be possibly hurting a bit. You might feel tired, you might feel achy the next day. But this is also the case with many vaccines, and we just take that for granted. So both the effectiveness and the safety of these COVID vaccines are really reasons why people should not hesitate to be vaccinated. Let me share some other information from research reports that have addressed how the coronavirus is likely to affect us in the long term. Over the past year, scientists have really made incredible progress in understanding what we might expect from the pandemic in the next few years. And not everything is dismal. A recent study in the UK evaluated about 20,000 healthcare workers who had been infected with the COVID virus and developed antibodies. The antibodies appeared to be just as protective as if the people had been vaccinated. So this really high level of natural immunity from infection was measured at 5 months post-exposure, and it's going to be followed into the future. So there's really good news here, and that is if you do become infected, regardless of your symptoms, it appears, you probably are protected against reinfection, perhaps for quite some time. That does not mean you should not get the vaccine when your time comes, but until then, you may be at lower risk. Remember also that one estimate believes that people are now convinced that these results are real, that at least 3 times more people have actually been infected than the numbers of official cases. This is mostly because some people experience fewer or no symptoms. So we may actually be reaching herd immunity at a sooner point in time than was once expected. From other research reports, many scientists are now beginning to believe that the COVID virus is here to stay. So this might sound like foreboding news, and it might end up being just like any other virus that humans regularly transmit among one another. Thinking here is that years from now, when most people have either been infected or received the vaccine, the COVID-19 virus will continue to circulate at really low levels, much like measles, mumps, rubella, and so forth. And so it may behave like what we call childhood diseases and will simply require systematic vaccination at a young age. These studies then suggest that one day COVID will just be another of many diseases that we control by regular vaccination. But in the meantime, we can continue to stay ahead of the virus by vaccinating as many people as possible and as quickly as possible, and of course, continuing to wear masks and social distance. Finally, in another research report, scientists have shown a huge side benefit of wearing masks and washing hands and distancing. And these behaviors that we undertake now to prevent COVID should also reduce the risk of other common respiratory and gastrointestinal viral diseases. During the past year, surveillance has now shown that there's been a decline in virtually all common respiratory and GI diseases. And the scientists who have studied this attribute this decline to those behaviors that were aimed at reducing COVID risk. So this is an added benefit that further reinforces the importance of good hygiene and thoughtful exchanges with our family and friends. So let me stop there, and I would be happy as well to answer any questions later on.
Thank you, Dr. Mark Wilson. He is Active Professor Emeritus, University of Michigan School of Public Health, Epidemiology. At this time, we welcome back Plymouth Police Chief Michael Botieri. Welcome, Chief Botieri. Mike?
Thanks for having me, Steve. Appreciate it. Can you hear me now?
We can. Go ahead.
Okay. I just want to touch on a couple of things that have already been mentioned, actually, the vaccine for first responders and public safety. So we actually received our first shot this morning. 7 o'clock we started here, and we're at the firehouse now, and they'll be back here later today. So over the next 4 or 5 days, we should have all of our public safety vaccinated. I want to take the opportunity to thank the Board of Health, the Director of Public Health, Karen Keene, the Board of Selectmen, everyone for their support in getting this vaccine to us. It was no small task. We had a couple of bumps in the road. Obviously, it's the first time the state did this, so we actually had a couple of mishaps. We had a hard time becoming an approved delivery site. Once that was all taken care of, we did get our delivery last week. However, they did not put the vaccine in. We had everything but the vaccine. So there was a mishap of about 2,400 doses, and 200 of those were ours. So they quickly corrected that. So everything's going well now. The actual vaccine was delivered yesterday, and we started administering it today. I know we had about 35 people receive the vaccine between 7 and 8 o'clock, 7 and 9 o'clock this morning, just here, and many more at the firehouse. So we should be well on our way. The only other thing I wanted to talk about was a little bit about the COVID ambassadors that we were able to hire through the Board of Health and Karen Keene. We felt that was a really great measure for us to have another layer of people for education and making sure people were wearing masks. And it was mentioned earlier, I think Dr. Triffletti might have mentioned it, that we really feel that the compliance level is high. We didn't think that a while back, but over the last, I would say, probably 6 to 8 weeks, we've really noticed a big change in that. So people are wearing the masks in the mandatory area downtown and on the waterfront. And I think, all of you driving around would probably see that. We see quite a difference in that. So we think that was a very successful program. We did track who we spoke with, what kind of result we received. we were getting a lot of people saying, I have a medical issue, I can't wear the mask. That did not happen. We did not get a lot of that. So that wasn't really a main issue, but we're happy to say that, through that program, we were able to get a lot of compliance, and it worked well for us. So that's all I really had. I don't have a lot, but I'll be available for questions.
Thank you. Plymouth Police Chief Michael Botieri will be here to answer your questions. Send them to plymouthinfo@pactv.org. We now go to our school segment. We welcome back Erik Cioffi. He is Assistant Superintendent for Plymouth Public Schools. Welcome, Erik.
Good afternoon, Steve. Thanks for having me. I'm excited to give you an update where we are with the school system. For those of you who have been watching our COVID dashboard, you would have seen a spike in our positive cases and our quarantine cases, which we kind of anticipated as we came back from our holiday break. We're kind of coming out of that at this point, so our numbers are starting to go down as where they were prior. As you may know, we did have a couple cases that we had to pay special attention to. One was a program at one of our elementary schools that we ended up having to close the whole classroom down, which ultimately impacted close to 12 teachers and paraprofessionals. This particular classroom program are some of our special needs students that require that hand close proximity. And I'll tell you, my hat's off to not only all of our staff that are working in this environment, but for the staff that work with our most at-risk students. They walk into school every day knowing that they will be within that 6 foot distance, because otherwise they wouldn't be able to perform the needs of the students. So they know going in each and every day. We've had to close down 2 of these programs at 2 of the elementary schools. Fortunately, those that had tested positive came out of their experience well, and nobody else was impacted. But we did quarantine close to 26, 27 teachers between those 2 programs. But the other big situation we dealt with, as you may be aware, is there was a gathering on New Year's Eve, as there was across the country. There were several gatherings, but specific to here, which impacted one of our high schools, Plymouth North. So when we started coming back, we started getting a lot of calls, and a lot of students were impacted by this. And as we were getting all of this information in, one of the things we are constantly doing is having communication with the Department of Public Health, contact tracing, and trying to identify those that were in proximity, those that have tested positive. It came in so quickly once we returned that we were in a position where we felt the best thing to do for that entire school was to close the doors for about a week. And that would get everybody out of that window of time. Some people were questioning why we didn't close the entire school system, but we were tracking cases school by school, or tracking them by families, and there was not the impact in any of the other schools that we were facing at Plymouth North. In the event that the data presented to us indicated that those other schools needed to be addressed differently, we absolutely would have. But I'll tell you, the work that our nurses have done, not just at Plymouth North High School, but all the schools, if you were to look at their contact tracing logs and the contacts that they've had with families and students, staff, to keep track of that to reduce the transmission at the schools has been just amazing. So we're continuing to watch that. We're starting to see ourselves come out of that break with our cases, whether they're positive cases or close exposures. So we look forward to seeing those numbers continue to come down for us. The other big thing that we're looking at right now is we're doing some research on exploring different COVID surveillance testing options. DESE, as well as the Department of Public Health, are looking to do a pooled strategy within the school setting. And what this would simply mean is if we had a group of individuals, I'm just going to hypothetically say 20 people would take an anterior nasal swab. This could be students and staff members, volunteers. We put them into one pool sample, and then that one entire test gets evaluated, and we get the results back within 1 to 2 days. If that pool comes back negative, everybody is presumed negative and they can, come back to school as normal. If that were to test positive, then those individuals that were in the pool, all of them, would go under a quarantine until they could have a negative test produced. So that's one option to get is a mass group together to do one test. The other option we're looking at is to conduct an individual PCR test through another company that Dr. Campbell and Carolyn Rains had sat in last week on a webinar, Zoom-based meeting. Same turnaround time. It would just be a one individual test. Again, it would be for those that volunteer or wanted to have that taken place. So we're going to be sending out a survey probably later today, this week, to kind of gain insight from our families and our staff to see if they'd be interested in either option, so we know what direction to go. As was mentioned, we've talked a little bit about the vaccinations. Educators are still scheduled in phase 2. We were given that range of dates from February to April. If there's been a delay in phase 1, we anticipate there could potentially be a delay in phase 2. We're hopeful it'll start early on in February, so we can start that distribution process and get that set up. We were very grateful and fortunate that our school nurses were included into phase 1. And a lot of our school nurses, they do have second jobs. They work in hospitals, so some of them had the opportunity to get that through their other positions that they've worked with. But knowing that they could go into phase 1 if they were not in that group was a good option for our nurses that are obviously day-to-day hands-on with students that potentially could be impacted through COVID. One of the other big things we've worked on really since the middle of December, DESE came out and reviewed all of the programs that each of the school systems in Massachusetts are delivering to their families and students, whether it's the hybrid model, the remote model, back to school live model. And they set up some guidelines that we were then forced to follow starting, actually today was our first day implementation at the elementary and middle school. And they evaluated all of our programs, and we looked at first grade, 4th, 7th, and 10th to look how much time our students were doing in synchronous or live instruction. And because we fell an hour short, just 1 hour, we had an opportunity to work with our union and work with our staff and principals to try and come up with a plan at each of the levels. So it looks very different at all 3 levels, so that our kids are having contact with their teachers not only every day, but will increase the learning time that they'll have, because those off days have been a struggle when kids are not physically coming in school or meeting with their teachers on the remote Monday. There hasn't been that direct contact. So we've put things in place. The high schools will start theirs on February the 2nd, where they'll be remoting kids into their live classes. And as I mentioned, the elementary and middle schools started their process today, where they were going to meet independently with the kids at home for a brief period of time. Right now, it's just 15 minutes at the elementary school and 20 minutes at the middle school. But we're hoping that connection will help provide some direction for our students who are at home. We know that our kids need us right now. We recognize that school has looked very different since about this time last year when conversations started. Officially, we went out in the middle of March, but there was that big baseline conversation last year, starting in around February, and it's been different for them, and it's been different for families, teachers, everybody, and it's no fault to anybody. But we are recognizing that the mental health issues among our students are growing. They're at an all-time high. But we also realize schools are a safe haven for so many of our children for so many reasons. And they struggle from home, working from home. It's not easy. We recognize that. It's not easy for our teachers to manage it. It's not easy for our students to navigate through it and for our parents to work through it. But given the circumstances that we're in, we certainly feel like we're providing the best model that we can for our students and families. And, we're always looking to make adjustments as needed. We want to keep our schools open as much as we can. But based on what happened just recently at Plymouth North and with our couple programs, if information's coming in and there's concerns, and with our conversations with the medical professionals, we're not going to keep going if there's a major concern. We value and know the importance of our students being in school, but we want them to do it as safely as we can. And that's one thing. With closing is, we feel like the practices we've had in place in September have allowed us to continue keeping our doors open, and we will continue to make adjustments as needed. We'll monitor our system very closely with our public health and our community and our schools, number of quarantines, everything that we're doing is what we're going to continue to do, because our students are our most precious thing that we have in our community. They're our future. We want to protect our teachers. When they went to become educators, this was never anything that they had planned for. This is something we're kind of learning as we go. We hope we're never in one of these situations again. But I continue to be amazed by, our teachers, our nurses, our bus drivers, cafeteria workers, custodians, our technology staff, our secretaries, our administrators, counselors. The list goes on, maintenance staff. What they're doing on each and every day allows us to be here for our students. So we look forward to the pandemic coming to a close. We look forward to the vaccines being readily available. And as well as everybody else has mentioned, I'll be on here till the end, and we'll be glad to answer any questions as they may come up.
Thank you, Erik Cioffi. He is the Assistant Superintendent for Plymouth Public Schools. Originally, we were scheduled to broadcast yesterday, but due to the events in Washington, we decided to delay until today. Following yesterday's inauguration, I felt pretty patriotic, and so this morning as I was getting ready for today, I decided to wear one of the Christmas gifts that I received this past Christmas, which has the name of our 46th president on the socks that I decided to wear. And our next panelist, Michael Jackman, was one of the panelists who was not going to be available yesterday. Mike, you've had a busy week working for one of our congressmen, William Keating. What do you have for us today?
Well, thank you, Steve, and thank you, as always, to PAC TV for the opportunity to come on and talk a little bit about what's going on at the federal level in terms of COVID-19 and battling the pandemic. Yeah, yesterday, as people have alluded to, was a great day. I thought it was important that we had the peaceful transition of power, despite the challenges that we've seen over the last few weeks. But Congressman Bill was very pleased to see what happened, and very excited about the opportunity to work with the new administration on a whole host of different fronts. But most importantly, as we've heard from the news reports, that the priority really is to overcome this pandemic and get people, keep people safe, get people vaccinated, get people back to work, and get the economy working again. So it's really exciting to see these priorities, and looking forward to that. I think the last time I was on was around the holidays, and the Congress had either just passed or was about to pass the so-called CARES 2 Act, which since then, the new president-elect at the time, had announced his rescue plan. And I thought it might be a good idea to talk about the two different plans so there's no confusion. The CARES 2 Act that was passed in December and signed into law by President Trump included the $600 round two of the economic impact payment, or the stimulus payments, as people are most commonly referring to. And a lot of those have already gone out. If you got the $1,200 round one payment, you most likely have already received a $600 round two payment. A lot of people who had issues with round one were able to correct those issues with the IRS and get the round two payments more readily. If you have not received the round two payment and you feel like you qualified for it, please do contact our office. We have a shorter time frame in order to help people correct that and get that second payment, because the IRS is saying that, as with the first EIP1, round one EIP, you'll be able to claim, if you qualified for it and did not receive it, you'll be able to claim it as a recovery rebate credit when you file your 2020 tax return. And you'll also be able to do that with the round 2, the $600 payment as well. So we have a shorter time frame because tax season is starting within just 2 weeks, really, less than 2 weeks. People are already getting their W-2s and whatnot, so that's important to do. I would just note on the IRS, we are working with them pretty much every day on behalf of constituents who filed returns and have for 2019 and have not yet received a refund. They have had significant delays because of major offices being closed. So paper forms were unopened for months. They're still going through a lot of those paper forms, unfortunately, and other obstacles to getting people those refunds. So we're urging people to be patient, but definitely let us know in our office if you're still having a problem. We have many folks who have contacted us, and we're working with them to try to get those refunds delivered as quickly as possible. The other big item, I think that, well, a few big items that were included in that CARES 2 round from December was an additional $300 stipend for folks who are receiving unemployment that goes through March, and also an eviction moratorium, which was extended from December 31st to January 31st, which will be likely extended further by executive action by President Biden. And the other thing in the CARES 2 Act was round 3. I don't want to confuse people with all these rounds, but the payroll protection program. And there was additional funding put in it, and a new application deadline was set. And they rolled the program out a little bit differently this time to try to maximize awards to smaller businesses. And so they phased it over a week and a half. The smaller banks, smaller financial institutions, and institutions that work with economically disadvantaged areas were prioritized to get the applications in before just every financial institution. But at this point, every bank that is participating in the program is accepting applications. I know the Chamber has done a great job getting the word out and working with their members and working with businesses in Plymouth to support them to try to get applications in. The Massachusetts Small Business Developmental Center, which our office, we often refer businesses to them. They're a great resource as well to help businesses do that. Just to talk a little bit about the vaccine, I think we've all talked about it pretty much because it's so important. And I think, Dr. Phil, I mean, you put it really clearly that you can't get 100 million people vaccinated if you only have 36 million vaccines available. And the state's doing what it can. They're doing a great job, I think. There's a lot of questions about why certain groups were prioritized. And we see some states, as you alluded to, had different priorities. I've read some states, even if you're a smoker, you get prioritized, and you don't have to prove that you're a smoker, I guess. You can go out and buy a pack of cigarettes and show up at the vaccination site. But I really do think the state is being very thoughtful about this and very deliberate about making sure that the vaccines are delivered in a way that's going to protect the greatest amount of people. But what it really comes down to is if there's no vaccine available or not enough vaccine available, then they have to ration it. That's what we're facing. And that's a good segue to talk about what the president's plan is. And he is proposing putting a big sum of money into vaccine development, vaccine delivery, which had been lacking in the previous administration, and additionally testing and contact tracing. Opening schools. Erik referred to the pool testing and possibly individual testing. If there's increased funding for individual testing, I think that would help schools open more readily than the pool testing. That's a great pilot program, but we want to see more testing, obviously. And direct funding to states and reimbursement for what states are spending. we've heard that the president has talked about FEMA reimbursing states at a higher level or for more items that are COVID related. So those are the things that we're looking at. We're hearing coming from the White House now. These announcements need to obviously take shape as legislation that the House and the Senate can consider. I don't think everything's going to come out exactly as is proposed by the White House, but I do think there will be more relief coming. So we're excited about that. We're excited about working with the White House, working with the rest of the House and Senate on getting these funds out to people and doing what we can to crush the virus. So again, thank you, and I look forward to any questions.
Thank you, Michael Jackman. He is District Director for Congressman William Keating. We're now going to go to our state report from Plymouth State Representative Matthew Muratore. Welcome, Matt.
Hey, good to see you, Steve. I was just watching the governor. Governor's doing a press conference now at Gillette Stadium with the owner of the Patriots, Robert Kraft. So just trying to get some more information out there. If I have any more information before the end of the show, I'll let you know. So let's look at the numbers in Massachusetts at this point. So confirmed cases since this began last March is 458,000 cases. We currently have 90,000 cases, active cases of COVID-19 in Massachusetts. The age group over the last 2-week period that have contracted the COVID-19 is the age group of 0 to 29 years old is 28,000. 30 to 49-year-olds is 21,000. 50 to 69-year-olds are 17,800, and 70 plus years old, 6,500. So you can see that it's still the younger population that's getting it the most. But however, it is affecting the older population. Total deaths have risen to almost 13,600 at this point in Massachusetts, with 7,800 of those coming from long-term care facilities. And looking at the deaths by age group, the 70 plus year olds, there's been 250 deaths in the last 2 weeks. The 50 to 69-year-olds has been 109 deaths. 30 to 49-year-olds has been 28 deaths, and 0 to 29 has been 17 deaths. So you can see more of the younger folks are getting COVID-19, but it's still affecting the older population, and particularly those with existing health conditions. Hospitalizations, as was mentioned by Dr. Phil, it's been stable. We were at a high of almost 4,000 back in April of folks that were in Massachusetts hospitals with COVID-19. Today we're at 2,200, and that's been stable for the last week or so. ICU is stable as well, with over 440 in the ICU, and of those, 299 are on vents. Talk about I just want to talk about Plymouth for a minute too. I know we don't have the Board of Health on, but in Plymouth, we're almost up to 120 deaths. We have 119 deaths in Plymouth now. So that number is rising fast. We've had 2,965 cases. So probably by the end of today, or if not tomorrow, we'll reach the 3,000 mark in COVID cases here in Plymouth. There's been over 6,600 tests of folks in Plymouth. That's not just individual people, that's the total number of tests of people that live in Plymouth. And our positivity rate in Plymouth is 9.3%. And the positivity rate in the Commonwealth has dropped, as Dr. Triffletti mentioned, to 5.86%. On New Year's Day, if you remember, it was at 8.7%, almost at 9%. So we're starting to see a downward trend here. I think as we move away from the holidays, that's where we're seeing this downward trend happen. So that has worked out. That has worked out good for us. With regard to the vaccine, I know it's been talked about a little bit. Just want to add a couple more things. Commonwealth is looking at students, pharmacy students, and physician assistant students to actually give the shots as well. So it's not so much getting the vaccines, but we need multiple groups of people to actually give the shots as well. So that's being looked at this point. To date, we have, as of Monday, we have almost 750,000 vaccines allocated to the Commonwealth, with over 340,000 administered, and that's ongoing. As you heard last week, Gillette Stadium is now is open and ramped up for vaccines. They are doing, just listening to Robert Kraft talk, they're doing close to 1,500 a day at this point. They're gonna be getting up to about 5,000 per day. Fenway Park will open up on February 1st, so that'll be another large site. They're looking to do about 1,000 per day. When Gillette Stadium gets up and running, that will be a total of 5,000 per day. Still looking for 4 more large sites. However, there are still, at this point, 115 sites in the Commonwealth that are now giving vaccines. There are 16 pharmacies sites that have come on board as of yesterday to provide vaccines. They are part of the CVS and Walgreens family. And so the closest locations to us are in South Yarmouth, Hyannis, and Mashpee. South Yarmouth is open now for shots, and Hyannis and Mashpee should be opening any day. But just caution you, that is for, at this point, we're still in phase 1, which is for the first responders and any healthcare, home care workers at this point. So those appointments can be made for if you fall under one of those categories. They're looking at 40 more sites to come on board very shortly in the next week or two. That will include in our area the Big Y, Stop and Shop, and Hannaford's as well. So there's more and more sites that will be opening up as we get more and more people to provide those shots. But currently we have 115 sites that include, hospitals, pharmacies, local, municipalities, whether it's schools or Board of Health or, fire departments, et cetera. So we are getting there. Just briefly on the phases, I do believe that we'll get through phase 1, which is wrapping up now with congregate care settings that include shelters, group homes. I know prisons. I know there's been a lot of controversy about prisons and why are prisoners being vaccinated before the general population. But we got to keep in mind that what the administration was looking at is vaccinating folks that are in close proximity to each other, whether it's long-term care facilities, rest homes, assisted livings, that can spread faster and get to more people. And actually looking at, where are the highest deaths? So it's all that congregate care living that's doing that. And remember, we got prisoners that have employees that work in these prisons. So we have to protect those just like we are our healthcare workers, whether they're in hospitals or long-term care facilities. The folks that work in prisons, and there's thousands of them that work in prisons in Massachusetts, they need to be protected as well. So, and then they go back out in the public. So you want to try to protect that spread as well. So I think we're on track for phase 2 to begin in early February. We've been working with the town of Plymouth, the administration, the delegation, and Chairman Tavares and Town Manager Rigi on a location in Plymouth for a vaccine site. I know the chief has been involved with that as well. We're actually working on that hopefully for phase 2 when the early education and K-12 workers are going to need their vaccines because they're in the early part of phase 2. So more information to come on that, but we're in the early stages of planning that. So hopefully that will become a reality. And that is, other than the total cumulative tests that have been done in Massachusetts, it's astonishing that we have given 12.5 million tests in the Commonwealth since this whole thing started. So, but we're coming to a crossroads where we're seeing the numbers of those infected going down and the vaccines going up. So there is hope, but we're still not there yet. We're, as I said, phase 2 will probably start early February. We'll go till probably April. And then from April to June, the plan is to get the rest of the population done. So I think we're on track for those phases now, Steve. And that's the update today.
Thank you, Plymouth State Representative Matthew Muratore. At this time, we're going to go back to our panel for their closing thoughts. We're going to begin with Dr. Philip Triffletti. He's an attending primary care physician at Beth Israel Deaconess. Phil, what do you want us to remember today?
Yes, thanks, Steve. lots of great optimism out there. It's great to hear from Matt that the state continues to stick to their timeline regarding the vaccination program. So I think we're going to see a confluence of factors going forward. Just remember, until we reach herd immunity, you want to continue with all those safety practices. Wear your masks universally. Try to avoid gatherings in your homes and elsewhere where you might have super spreader events. I look forward to seeing you all in a couple weeks. Thanks.
Thank you. And that's Dr. Philip Triffletti, primary care physician at Beth Israel Deaconess. Last time I mentioned that the Plymouth town meeting will be remote, and this morning I was speaking at a local radio station about tonight's Committee of Precinct Chairs meeting, and I reminded listeners that when asked the question, as I was, about when we'll have an in-person meeting, I mentioned that we'll be guided by our scientists and our medical experts. So we thank the people each week that join us as medical experts, and we're now going to go to Dr. Mark Wilson, who again is one of the people upon whom we rely for accurate information. Dr. Wilson, what's the takeaway today?
Well, thanks, Steve. I guess I would just say that today is really, for many reasons, especially because of the inauguration, really a new day. What we heard in the last hour is consistent with this, mostly good news and quite uplifting. Vaccines are on their way, and many of us will be protected in the next few months. People continue to practice behaviors that reduce transmission risk. Plans and actions are functioning well in the school system and are supporting disease prevention in different education modes. Government assistance is available through CARES rounds 2 and 3, and vaccination sites are opening. So again, in many ways, this is really a new day. Indeed, it's now really a new year. Thanks.
Thank you, Dr. Mark Wilson. He is an epidemiologist from Plymouth. We're now going to go to Plymouth Police Chief Michael Botieri. Chief Botieri, Representative Muratore reminded us about prisoners. Certainly your people deal with people that eventually become prisoners, so they're certainly at risk. What are your closing thoughts today?
Well, I just want to mention that we're very thankful that we started receiving the shots today. Like I said, I'm appreciative of all the support the town gave us. I do want to mention, I think I neglected to mention Brewster Ambulance, and they have stepped up and they are actually administering the shots, the vaccine, to all of us. So I just want to give a shout out to them. Appreciate everything they're doing to help us with this, and I'm sure they'll help us in the future with the rest of the community. So thank you.
Thank you, Plymouth Police Chief Michael Botieri. Going back to the Plymouth Public Schools Assistant Superintendent Erik Cioffi. Erik, what should we remember today from your presentation?
Well, I think one of the takeaways is, we react to the information that we receive from our students and our staff and our families. To put your head around it, in our high schools, they'll have anywhere from 600 to 750 students and staff in their building on any given day. And when you look at transmission and you look at the quarantine numbers, when you look at that large of a scale, the measures that are in place truly are one of the safest places that our students and staff can be when you're talking that many people. Our elementary schools can have anywhere from 300 to 400. Even though we're on a hybrid, you still have a lot of staff and students within the buildings, and they're following those safety guidelines. So just know that we will report out the information that comes to us. We're going to keep our students and staff. Safety is our number one priority. That's what we think about going to bed at night, and that's what we think about when we get up in the morning. So it's a big task, kind of all in this together.
Thank you, Erik Cioffi. He is the Assistant Superintendent, Plymouth Public Schools. Michael Jackman, following yesterday's events in Washington, I've certainly, being in the community, have sensed some happy optimism. I was actually at the gym this morning, and a woman told me that although her husband was disappointed and didn't want her watching TV yesterday, she was able to sneak some time to watch some of the events. So what is it that you would like us to think about today as we move forward?
Yeah, echo Dr. Mark Wilson's words. It's a new day. The president talked about democracy has prevailed, but he also talked a lot about unity. So I just hope that those households, families, communities that have felt divided can come together around the truth, around the need to work together to overcome this pandemic. We're not going to do it if we're divided, and there are resources available from the community, from governments, but really working together is the key to it. And I hope we're able to move forward in unity and together to make sure that we're all safe. The only other thing I would say is if folks have questions about any of these programs, the economic impact payment, the payroll protection program, any other federal programs, please do give our office a call. I neglected to give the number before, but people can reach us at 508-746-9000. Our offices are closed to the public, but you can always reach us by the telephone. So thank you again, and I look forward to hearing from everyone in the next few meetings. Thank you very much.
Thank you, Michael Jackman, District Director, Congressman William Keating, and we close out our panel each week with Plymouth State Representative Matthew Muratore. Matt, anything else from the governor?
Nothing new, but I do want to make a correction if I can. I indicated that the age group in the last 2 weeks of deaths, 70 plus was 250, 50 to 69 was 109, et cetera. That was the age group of hospitalizations. The deaths in that last 2 week period, 70 plus, there were 753 folks who have passed away because of COVID-19. Ages 50 to 69 was 190. 30 to 49-year-olds was 21, and 0 to 29 was 5. So again, you can see the dramatic effect that the virus has on the older population, even though it's mostly the younger population that is getting it. So the older folks are getting it from somewhere, so you can make the connections there yourself. Just to play off a little bit off of what Mike Jackman had to say, I think it's all about, I think, civility and respect one another and kindness, and I think that's something we've always practiced here in Plymouth. I mean, no matter what side of the aisle you're on, and I'm in probably the minority party here in Plymouth, but I always get treated with kindness and respect, from my colleagues on the local level and the state level and the federal level. And it's all about us working together with a common goal of helping the people that we serve. We all are elected or appointed or hired to do a job, and that's to work out whatever issues are. And we have a lot of issues in this town, in this state, in this country. And we are hired, to do that. And I think that's what people expect us to do. So I echo Mike's comments, and I think we will see better days ahead, when it comes to civility and respect and kindness of one another. There is hope. There's hope in a lot of ways, and I think there's hope with this, seeing the numbers start going down with the COVID-19 cases and seeing the vaccines going up. And I think we're going to see new plans coming in. There's been some mishaps, with the vaccine. We're promised 1 week a total number of vaccines, and another number comes in. It's a lot less than we thought. So it's harder to plan when you don't know exact what you're getting. So I think some of that stuff will change for us as well. And I think the planning will be a lot smoother as we go forward. So as I know, as Dr. Phil has said this before, and I continue to say this, I think that we need to control COVID because controlling COVID is good for our economy, it's good for our schools, and it's good for our health. So we'll see you all next week.
Thank you, Plymouth State Representative Matthew Muratore. And now we're going to end with Chair of the Select Board, Ken Tavares. Ken, Representative Muratore reminded us that we've had 119 deaths in the town of Plymouth. We can't recognize all these people, but they have names, they have families. This morning I received a call from a family member of Constance Davis. She's a resident of the Pine Hills, and she has passed due to COVID. Her funeral will be conducted by Shepherd Funeral Home in Kingston, and our sympathies go out to her daughter Jody Mayette and to her family. But for all the people who have lost, of the 119 people in Plymouth, we think about them, and hopefully this program will help viewers who watch and are trying to deal with coronavirus. Ken Tavares, what do you have for us as we close today?
Steve, what I have goes back a day, and I'm going to reflect on yesterday, as many on the panel have done today. Yesterday was a day of inspiration. We're coming up on a year when all of us started to actively work on COVID and trying to defeat it. And I've a number of times placed myself, what was I doing a year ago? What were we doing in the town of Plymouth to prepare ourselves for it? And what I have found during times of great stress and certainly uneasiness, it's always great to go and look at the words of others that have experienced things that we're going through. But yesterday, we had the opportunity to listen to a young woman, Amanda Gorman, the Youth Poet Laureate, is 22 years old. And if to use an expression that probably isn't appropriate, she stole the show yesterday. She summed up absolutely everything that so many of us have talked about privately, publicly, about, where are we going, and how is this going to end? And I can tell you that her words were of great comfort for me. There were a lot of good words yesterday, good things to look forward to. But Amanda said it all. And if you have the opportunity, I know that her poem is online. It's called The Hill We Climb. And the words fit in beautifully. We are going to be okay. We're going to get there. And I want to thank Amanda and the people that have educated her for being able to put those words in such an appropriate way for those of us that are concerned to get inspiration from. So thank you, Amanda. Thank you to the panel. Thank you to everyone that's taking care of our first responders. We see movement, I think, for the first time in a while. We're headed in the right direction. Thank you.
Thank you, Kenneth Tavares, Chair of the Plymouth Select Board, and I certainly share your views, Ken. I happen to see her speaking in the moment and instantly recognized that we had seen something very special as we try to navigate this time with the coronavirus. I'd like to thank all the members of the panel today, Ken Tavares, Matt Muratore, also Dr. Philip Triffletti, Dr. Mark Wilson, Plymouth Police Chief Michael Botieri, Erik Cioffi, Assistant Superintendent of Schools, Michael Jackman, District Director, Congressman William Keating. Thank you for joining us. We'll be back here next Wednesday at noon. I'm Steve Triffletti, Plymouth Town Moderator, and good day.